Good afternoon, everyone. I would like to thank the group of Miss Octavio for inviting me to talk about hypoxic ischemic encephalopathy as a complication of cardiac arrest. This 61-year-old male presented with tension pneumothorax, and as a complication of the tension pneumothorax, this patient eventually went into respiratory arrest and cardiac arrest. What I can say is, this case is very complicated. I have several questions. One is, did the patient fall because of the stroke? Or did the stroke occur together with the tension pneumothorax? So in this case, a very good history is important in order to arrive at the correct diagnosis. In the end, the patient suffered from ischemic stroke, mainly affecting the right hemisphere, hypoxic ischemic encephalopathy with a discharge diagnosis of decreased CNS drive to breathe, secondary to acute cerebral infarction of the right posterior cerebral artery territory, status epilepticus, secondary to HIE, secondary to cardiopulmonary arrest, status post-PTB in 2014. As a review, these are the arteries of the brain, and please take a look at the posterior cerebral artery territory. So, as shown in this slide, the territory supplied by the posterior cerebral artery is indicated by the color blue. So, this artery does not supply the cerebellum, the basal ganglia, and the frontal lobes, which are also involved in this case, or as shown in the CT scan of this patient. Breathing. Breathing is controlled mainly by the lower brainstem, that is the medulla and the pons. Neurons in discrete regions discharge with each breath and together generate the respiratory rhythm. Respiratory drive is the intensity of the output of the respiratory centers and determines the effort of the respiratory muscles. A contribution of chemical, mechanical, behavioral, and emotional factors contribute to respiratory drive. So what is hypoxic ischemic encephalopathy or HIE? So this is a brain injury that occurs when the brain doesn't receive enough oxygen or blood flow. And one of the most common manifestations or symptoms is seizures, which happened in this case. And the most common cause is a cardiac arrest. And the prognosis depends on the severity. In mild to moderate cases, the prognosis is good, while in severe cases, it could be dismal. And the treatment aims to minimize the degree of disability or injury by optimizing the balance between cerebral oxygen delivery and use. The adult brain weighs about 1,500 grams, and this requires an uninterrupted supply of about 150 grams of glucose and 72 liters of oxygen every 24 hours. Our brain does not store these substances, and so dysfunction results after only a few minutes when either the oxygen or the glucose content is reduced below critical levels. When the neuron or the nerve cell dies due to ischemia or anoxia or hypoxia, it undergoes a lot of processes. In more severe degrees of hypoxia or ischemia, this may lead to selective damage to certain layers of cortical neurons, and if more profound, to generalized damage of all the cerebral cortex, deep nuclei, and the cerebellum. The nuclear structures of the brainstem, and spinal cord are relatively resistant to anoxia and hypotension and stop functioning only after the cortex has been badly damaged. A patient who suffers a severe hypoxic ischemic encephalopathy does not only manifest with brain manifestations, but it also involves other organs such as the lungs, the gastrointestinal tract, the liver, the kidneys. For prognostication, neuroprognostication is vital and yet continues to be one of the most controversial topics in post-resuscitation care, specifically in relation to HIE. The 2006 practice parameters of the AAN provide specific recommendations for the prognostication of neurological outcomes for cardiac arrest survivors not treated with therapeutic hypothermia. To date, there is no adequate paradigm for prognostication in HIE. The clinical neurological exam has traditionally been the cornerstone of neuroprognostication. Absent pupillary or corneal reflex, extensor or absent motor response on post-arrest day 3 predicts a poor neurological outcome with a 95% confidence interval based on AAN guidelines. I think this is the end of my talk. I would like to thank everyone for listening and thank you for inviting.